Welcome this afternoon to the UCLA Health webinar, UCLA MD Chat. My name is Dr. Nina Shapiro. I'm the Director of Pediatric Ear, Nose, and Throat at Mattel Children's Hospital, UCLA. I'm a professor of head and neck surgery at the David Geffen School of Medicine at UCLA. And I'm the author of Take a Deep Breath, Clear the Air for the Health of Your Child, which is a parenting book talking about all breathing issues in kids ages 0 to 5. If you have any questions during the webinar or afterwards, you can use the hashtag UCLAMDchat, and I'll be answering them at the end of the discussion. So we're going to be talking about winter illnesses in general, and we're going to start with the most basic problems that we see in our kids, and then work down the respiratory system into some more detail. So colds. Most respiratory illnesses that kids and adults have are colds. Kids get up to 5 to 10 colds per year, and these can last 4 to 7 days, and this is all normal. But if you do the math, and if you have one child, that could be anywhere from 20 to 70 days per year of a cold. If you have 2 kids, 40 to 140 days. 3 kids, it goes up to even over 200 days per year where someone will have a cold in the house. And this does not include you, the parents, who are also getting sick, and unfortunately oftentimes our colds last longer than our children's colds. So this could be a lot of colds during the year. It's a little bit higher volume during the winter months, so we see a lot of sickness, and it really feels like a revolving door where our kids are always getting sick. So what are symptoms? Just basic symptoms of a cold, as most of us know: stuffy, runny nose, a little bit of a cough, a low-grade fever can go along with a cold, and a little bit of decreased energy and appetite. And obviously, if your child has a cold, even if they're not that sick, that's the time to keep them home, whether it's from daycare, preschool, or elementary school. Most colds are caused by viruses, so you do not need antibiotics for a cold. They will not cure a cold, and they are not necessary. And actually, most over-the-counter medicines don't help and do not work and are potentially dangerous for kids with colds. So cough medicines, decongestants, cough suppressants are really not necessary when your child has a cold. So what do? Cold treatment, again, we're talking very basic stuff here: rest, fluids, even chicken soup can help. There's electrolytes in chicken soup, which is good for rehydration if there's a little bit of a fever. There's some protein, there's a little bit of steam for that stuffy nose. So basic chicken soup is still great for a cold. Nasal saline, this is over the counter, you do not need a prescription, is great just to clear out your child's nose. A humidifier, cool mist is best. It's a little cleaner than the warm mist humidifiers. And have your child sleep with an extra pillow if they're old enough to have a pillow when they're sleeping at night. You may consider a nasal decongestant, which is a nasal spray, something called oxymetazoline or Afrin, which is over the counter. But I absolutely recommend that you check with your doctor first to make sure it's safe for your child in particular. Acetaminophen or Tylenol or ibuprofen, also known as Motrin, is fine for children if they have a fever or a little bit of discomfort. It's really not necessary, though. Even if there's a little bit of a fever, you don't have to give these medications to your child. One of the best things that we can do for our child who has a cough is honey, 1 to 2 teaspoons at bedtime if your child is over 1 year old, has been found to improve and reduce some cough symptoms in kids with colds. So when is a cold more than a cold? Most of us are very familiar with a basic cold, but when does it actually become something more significant? These are the kids where the cold symptoms go on for more than 7 days. High fevers, so 102, 103. Lethargy, weakness. They really have no interest in their usual playing or toys or interaction. They really can't even get out of bed sometimes. And then the cough seems to change. It could become a wet cough, a little bit of a barking quality or hacking cough, a dry cough. So when you call your doctor, if you're concerned about your child's cough, just think about what it sounds like, because it really does help to describe what's going on and help us as doctors understand what's going on with your child if you can describe the type of cough that he or she is having. Another issue that may come with a cold is what color is the mucus? We all talk about this in our field of ear, nose, and throat, but it's something that we all sort of need to think about when our child is sick. What color is the mucus? If it's green or yellow, it doesn't necessarily mean it's a bacterial infection, but it can signify something more than a cold. Green or yellow sputum, if they're coughing up material that's a little bit darker in color, that may mean that there's something more going on than just the usual cold. If they're complaining about a sore throat to the point where they can't eat or drink, then there may be something else going on. A headache, most kids don't have headaches, and so if they do have a cold with a headache, you want to look into something else as well. If they're not sleeping, if they're having trouble breathing, if they're not eating and drinking, these are all signs that there may be something else going on. So what else can it be? And we're going to run through all of these today, starting with the ears and working down to the lungs. So an otitis media or ear infection is a very common entity that goes along with a cold. Sinusitis, strep throat or tonsillitis, flu, RSV we'll talk about, pertussis or whooping cough, croup, and bronchitis, and then pneumonia. So otitis media or an ear infection is actually a respiratory illness. We often think about it as something separate because you see the ears on the outside of your head, but it's actually part of the respiratory system. The middle ear is in direct connection with the back of the nose, so it is part of the respiratory illnesses. So kids with stuffy noses, runny noses, coughs may develop fluid in their ears. This fluid is not necessarily infected, but it can become infected. Another thing to remember is that most ear infections, just like most colds, are viruses. They're not necessarily bacterial, so all ear infections do not necessarily need antibiotics for treatment. But across the board, they hurt. So some symptoms that go along with an ear infection: irritability, ear pain, one or both ears. Some of the younger kids can't really describe this, but they may be holding at their ear. Most ear infections are double. Parents often say, oh, my child had a double ear infection. Well, that's pretty typical. Most ear infections are in both ears. A fever can go along with an ear infection. A cough, sometimes a cough can actually trigger the fluid to go into the middle ear, and sometimes the fluid in the middle ear can make your child cough, so that becomes a little bit of a vicious cycle. They usually can't sleep at night, and as with most illnesses in children, everything is worse at night and during their naps. So is this an ear infection? This is a typical child that we see who has ear pain. It may or may not be. You can have a sore throat with ear pain. You can have fluid in your ear with ear pain. A cough can cause some ear pain. So touching the ear and looking uncomfortable is not necessarily an ear infection. This is an ear infection, and this is what we as the doctors see. You can see that this eardrum is swollen. There's a lot of pus filling the whole eardrum, and it's bulging out, and it's sort of that yellowish color, and that's the pus itself. So that is what an ear infection looks like when we see a child in the office. So the diagnosis is really made by an exam of the ears. I know we have those little ear checks that you can buy, which will determine whether or not they're fluid. There's mixed thoughts whether those are accurate. But fluid is very different from pus, and pus is when it's infected. A red ear does not mean it's infected. It can be a cold. If a child is teething, they can have ear pain. If they're crying, their eardrum looks red. Coughing can make the eardrum look red. And again, fluid is not necessarily a bacterial infection where a child would need antibiotics. So this is, again, to demonstrate that the ear is connected to the respiratory system. So here we have this eustachian tube, which is a muscular tube that goes to the back, from the back of the nose to the middle ear. And this tiny little space here, which is about 1 or 2 cc's of fluid, that's what fills up with an ear infection. This gets filled with fluid, and it pushes this eardrum out. The eardrum has a lot of nerve endings on it, and it's very, very sensitive, so any sort of swelling of that eardrum is what causes the pain of an ear infection. The fluid from the back of the nose, whether it's infected or not, travels up there, fills the middle ear space, and pushes the eardrum out, and that's what an ear infection is, and that's why it hurts so much. So what is the treatment for an ear infection? Actually, if your child is over 6 months, 24 to 48 hours of just pain medicine, acetaminophen or ibuprofen, is reasonable. Again, most ear infections are viral, so most kids do not need antibiotics. If they're not better in a day or two, that will be a child that would need antibiotics. For the younger kids, 6 months and under, we recommend going ahead with antibiotics right away in addition to acetaminophen. We do not recommend ibuprofen in kids under 6 months of age. So a little bit about the demographics of ear infections. It is the most common reason for a child to go to the doctor's office, an earache. About $3 billion per year in this country alone is paid for ear infections, and that's direct costs only. That does not account for indirect costs such as work missed, transportation, parking, school missed, extra child care, all of the extra stuff that goes along with a child being sick. That's not included in that $3 billion annual cost. The antibiotic overuse, giving antibiotics for any child with an earache, has led to a widespread resistance of the most common bacteria that we see normally to treat with the most common antibiotics. Moving down to the sinuses a little bit, this is an example of 3 age groups with what their sinuses look like. And you can see, especially in the 1-year-old, the sinuses are extremely small relative to the rest of the child's face. So a sinusitis is actually quite difficult to diagnose because the sinuses are so small. A little bit of fluid in the sinuses will always be there in a 1-year-old or even a 5-year-old with a cold. So that doesn't necessarily mean that they have a sinus infection per se. So how do we know if it's a sinusitis in a child? Not necessarily a cold, not necessarily a green runny nose. That's not a sinus infection, but a prolonged cold. So again, that cold that's lasting more than 7 days or so, with a cough, with a headache, fever, runny or blocked nose, fatigue, facial discomfort. The older kids can actually say that their cheeks hurt and their forehead hurts. They can have some foul breath because the dripping of the mucus from the back of the nose will go into their mouth and they'll have bad breath. And they'll also have some difficulty sleeping because it's going to hurt more when they lie flat. It's very difficult to diagnose sinusitis in children. X-rays and even CAT scans or CT scans can overdiagnose sinusitis. Again, those sinuses are so small that a child with a cold will look like sinusitis on an X-ray or a CAT scan. Even if a child is coming in for a CAT scan for another reason, they will have sinusitis on their CAT scans more often than not. So diagnosis of sinusitis cannot be just based on X-rays. It has to also be with symptoms. So again, this is a child who looks sick, thick mucus, a wet cough, a cold that's not getting better. That may be a child with sinusitis. Treatment, very similar to a cold: humidification, nasal irrigation. I recommend saline in newborns and up to spray the child's nose a couple of times a day. It flushes out a lot of that mucus that's sitting there. Possibly a nasal decongestant. Again, check with your doctor before using any medication, even if it's over the counter. Elevate your child's head during sleep. And then antibiotics if it's a child who's not getting better with these treatments. Now, what about strep throat and tonsillitis? Thankfully, we're not seeing as much of this these days. It used to be much more common many years ago. Painful sore throat. This is the kind of sore throat that hurts to the point where a child does not want to eat. Belly pain can also be a sign of a strep throat in particular. Swollen glands in the neck. These are actually the lymph nodes in the front part of the neck. They can get swollen and quite tender in a child with strep tonsillitis. The tonsils themselves will be red and swollen, and you may see some white spots on the tonsils. Most kids who have strep throat also have a fever. So this is an example of what strep throat can look like. You can see that there are these white spots on the tonsils. But again, this could be a virus. So even with an exam that looks like this, we need to do a throat culture to see if it is indeed a strep throat. So we do a throat culture. This can be done in the office, what's called a rapid strep test. Usually within a few minutes you can find the answer. If it is negative, your child does not need antibiotics. If it is positive, they do need antibiotics. Sometimes the strep culture can take a day or two to grow, and at that point your doctor can decide whether or not it is a bacterial infection. It can be very contagious in its early stages, and usually if it is strep, your child is started on antibiotics, they get better they start to feel better at least within a day or two. They also may need some pain control if they're not able to eat or drink. But big tonsils don't necessarily mean that your child has tonsillitis. This is an example of a very healthy child who came into the office with big tonsils. These are not infected, they're not inflamed, they're just big. So having big tonsils does not necessarily mean that your child needs antibiotics or that they have an acute infection going on. So when does your child need their tonsils out? We often say no tonsils, no tonsillitis, and this is very true. But does your child really need their tonsils out if they've had a few episodes of strep throat? And the guidelines have changed over the last few years. Now we recommend about 7 episodes of tonsillitis per year in 1 year, 5 episodes of tonsillitis per year for 2 years, or 3 episodes of tonsillitis per year for 3 years. So that's a lot of strep throat before we recommend considering getting your tonsils out. However, the majority of kids today who are getting their tonsils out, it's for loud snoring, sleep-disordered breathing, obstructive sleep apnea, and daytime fatigue. I'd say about 80 to 90% of kids who come in for tonsillectomy have sleep problems as opposed to recurrent tonsillitis. Now, what about the flu? We know at UCLA, everybody should have their flu shot if they are in any contact with patients, and this really goes across the board. Everyone should get a flu shot. We're entering flu season. It says November to March. It actually starts a little bit earlier, so we always recommend by late September, and actually now we're into October, that you get immunized. This is always a little bit surprising. The flu shot is about 60% effective, which is actually a pretty good shot. People think that it's going to protect them 100% from the flu, and this is not the case. And this is why you still can get the flu if you get the flu shot. But if you do not get a flu shot, it will be 0% effective. So 60% is certainly better than 0. Flu shots can be given to children up to beginning at age 6 months. And the flu mist, which is a live virus nasal spray, can be given to patients between ages 2 years and 49 years. And it's also recommended during pregnancy, and it is safe to be given during pregnancy. It takes about 10 to 14 days to become effective. So if you get the flu 3 days after your flu shot, it is not from the flu shot. You were exposed to the flu and you're not yet protected. So you cannot get the flu from the flu shot, and it will not give you the flu, and it will hopefully protect you. So stay healthy this season. It is a virus, so antibiotics do not help. Antivirals such as Tamiflu and Relenza may cut symptom duration by a day or 2, but it will not get rid of the flu. It is very contagious, spread by droplet exposure, and the symptoms hit hard and fast. For anyone who's ever had the flu, it is different from any sort of respiratory illness that you've had. Extreme fatigue and weakness to the point that calling your office to cancel your day is about as much energy as you can do throughout the day. You usually have a high fever, you can have a cough, nausea, vomiting, nasal congestion, and these symptoms can last for anywhere from as few as 3 days to as long as 14 days. Respiratory syncytial virus, or RSV, is another type of cold virus, similar to the flu virus, but actually more similar to the regular old cold virus. This is a virus that we see in young children, and it's usually mild and similar to a cold. Most of our kids have had RSV and we don't even know it. It's usually very similar to a stuffy nose, runny nose, sneezing for a couple of days. The season is a little bit later than the flu season, winter, spring, and it's most common, again, in the younger kids, in the infants and toddlers. It can progress, however, to bronchitis and pneumonia in young infants, so if you're concerned that your child may have RSV and they're quite sick, that's a time to go to the doctor. Bronchiolitis can also progress from RSV, and this is inflammation of the very small airways between the bronchi and the alveoli, or those little air sacs in the lungs. And if the bronchioli get inflamed, it's very difficult for your child to breathe. So prevention for RSV, I'm a big vaccine advocate, but there is a vaccine for RSV, but not everyone is eligible. There's very strict criteria on who can get an RSV vaccine. So children under 2 with heart or lung disease, a premature child born at 28 weeks or equivalent to a 7-month delivery, and they're under a year during RSV season, which is roughly February to April, they get the vaccine. Child 29 to 32 weeks and who's under 6 months old during the RSV season, or children born between 32 and 35 weeks, under 3 months old during the RSV season, or a child born less than 35 weeks with any neurologic problems. So again, they're very specific criteria put out by the American Academy of Pediatrics as far as who should get and who can get the RSV vaccine. Again, it's a very prevalent virus. Most of our kids have had it. You don't even know that your child has had it, so we don't immunize everybody against RSV. The diagnosis of RSV is made with a nasal swab, and you can do that in the pediatrician's office. The results usually get in less than an hour. And it's a child that's progressing from a cold to something more significant, coughing, difficulty breathing, which would be bronchiolitis or pneumonia. So again, bronchiolitis is that inflammation of the very small airways, which may lead to pneumonia, which is actually a lung infection. There are about 100,000 hospitalizations per year for RSV, and unfortunately about 4,500 deaths each year from complications secondary to these pneumonias. So if the baby is well, they can be treated at home. Even if they do get a diagnosis of RSV, if they have mild cold symptoms, they do not need to be at the doctor's or in the hospital. However, if it's an ill child, these are the kids who are hospitalized, and we have many sick kids, usually again during the late winter and early spring. They need humidified oxygen. They need to be monitored quite closely to make sure that the disease does not progress. They can get breathing treatments, and occasionally they need to be intubated and placed on a ventilator, although thankfully this is quite rare. Now, what about pertussis? This is a preventable illness. There was a large outbreak in California in 2010 with greater than 9,000 cases, and we're still seeing cases of pertussis or whooping cough in California as well as many other states. There were 10 infant deaths in California in 2010 secondary to whooping cough. Even if a baby is receiving their vaccines on schedule, they are not immune to pertussis until age 8 months. So if you have a young infant and they're exposed to pertussis, even if they've been getting their shots and their boosters, they are at risk for getting this disease. If you have school children, I strongly recommend that you go to your school's website or the state website, and the vaccine rates are public information, whether it's a public school, private school, or parochial school. You can find out what the immunization rates for your particular school. I also encourage you to go to the website soundsofpertussis.com, where you can see what this illness really sounds like. We also call it the 100-day cough because adults can get it and they can literally have coughing spasms for up to 100 days. It's also recommended that pregnant women receive a booster immunization, even if they have been boosted in the past, during their 3rd trimester, and this will give their baby a little bit more immunity during those first few months when the baby's not protected. The vaccines are called most commonly the DTaP vaccine, which for infants is given at 2 months, 4 months, 6 months, and then a booster again at 4 to 6 years. And then when you're a bit older kids and adults get the Tdap, which is very similar, and that's given at about age 10, and then every 5 to 10 years plus pregnancy after that to be protected. Now, what about croup? This is another virus. There is no vaccine against croup per se. It is similar also to the cold virus. The virus most commonly which causes croup is called para-influenza virus, but it is not the flu. It is not the flu virus. It's very common in 3-month-olds to 18-month-olds, and it leads to a swelling in the upper windpipe, so right below the vocal cords. It is a very, very striking bark-like cough, usually, as with most bad things, in the middle of the night, and it may cause some breathing trouble in your kids. So if you hear one of these in the next room, it's probably your child with croup. So what do you do with a child with croup? First of all, take 2 deep breaths. I wrote a book called Take a Deep Breath, but you will need 2 deep breaths for this because you're usually in for a long night. First thing you want to do is to go outside. Even if you live in a dry area, there's going to be a little bit of humidity outside. Bundle up your baby if it's cold or raining, and then keep your baby upright. And sometimes just being outside for a few minutes with your baby awake, breathing some of the cool night humid air may make their breathing better. You can also try a steam shower if you can steam up your bathroom. The other thing that's quick and simple is open up the freezer. Bundle up your baby and have them stand next to the freezer because that's perfect cool mist humidification right there. Obviously you don't want to do that all night, but initially that may relieve some of their symptoms. If these are not making your baby better, then you need to go to the ER or call 911. Don't forget about your other kids at home if they're comfortably sleeping. You don't want to leave the house, obviously, with your kids. If you get to the ER and your child is better, you should still have them be seen, because if they were sick enough for you to bring them to the ER, you want to make sure that they're okay before they go home. What are they going to do for your child in the ER? They'll probably give them some breathing treatments, maybe some nebulizers. It's always a good idea to ask and to write down what your baby's receiving, just to know if it's going to work, if it's going to work in the future, and just to have a record for your doctor for follow-ups what your baby did receive when they were treated. They usually can receive some oxygen if they're having any trouble breathing, some steroids, which can usually be given as a shot or an oral medication to reduce some of the swelling. These steroids usually work within a matter of 10 to 20 minutes. They may monitor their oxygen and heart rate, and they may send you home with a prescription for steroids. You do not need antibiotics. This is not a bacterial infection. If your baby has had croup once, it is very likely that your baby will have croup again. Most kids who get croup get it again, so always be prepared. Ask your pediatrician if he or she is comfortable giving you a prescription for steroids to take home and also to travel with. Home steroids given on a one-time basis can save you a trip to the emergency room and can get everybody back to sleep that night. They usually, again, work at about 20 minutes, so that can make for a much more pleasant evening. And I always like to think of the worst case scenario. Why would we need to travel? It's not croup season, our child is healthy, nothing's problem. Think of the worst case scenario. For example, being in the desert, not that I've ever done this on Easter Sunday with a child with croup. You don't want to be stuck in the middle of the night. You can't take them outside because it's 10% humidity. So you really want to be prepared wherever you travel because you never know. Now what about bronchitis? This is a little less common and it can be bacterial or viral. And this is an extension of the upper respiratory infection to the small airways between the windpipe and the lungs. So not quite the bronchioli, which are those tiny little airways, but just the bronchi, the branches of the windpipe. This is usually a deep, wet cough, so not just that upper airway cough that you hear in a child with a cold. Usually they're fatigued because they're having a little bit of trouble breathing. They may not be in acute distress, but they're really not that comfortable. The treatment, if there's concern for a bacterial infection, and this is quite hard to tease out, but these are usually the kids who've been sick for more than a week, they may need antibiotics. Humidifier is always good to have. Cool mist, again, is better than warm. And then nebulizers. And so we'll talk a little bit about nebulizers. What does your child need and why? And then rest, because they're going to be a little bit tired from all the breathing trouble. Pneumonia is a progression from bronchitis or bronchiolitis down into the lungs. Again, it can be viral or bacterial. They may or may not need antibiotics. It's diagnosed by physical exam. Your doctor will hear that there's not as much breath movement on one side of the lung or one part of the lung. And also a chest x-ray will oftentimes help in diagnosing pneumonia. You may or may not need to have your child hospitalized depending on how well they do. And that's when we talk about walking pneumonia. It's not really this pneumonia that's walking around. It means that your child is well enough to recover at home. And then humidification also helps clear out the airways. Nebulizers will be given in oxygen in the hospital if your child is having any trouble breathing. So what about nebulizers? These are given so often, and it's really important to understand why they're being given and what they're doing and how they're helping your child. They can be given for acute breathing problems, such as bronchitis, pneumonia, or croup, and these are not necessarily kids who need to be on them long term, or they can be given for chronic breathing problems. So the child who has a cold and then coughs or wheezes for 6 weeks after each cold. So it seems to be that they're always recovering from a cold, but their recovery takes quite long. They cough and wheeze all winter, even when they're not sick. These are kids who may need some nebulizers. They cough and wheeze with any sort of exercise or cold temperature, something called exercise-induced bronchospasm. This is a child who may need nebulizers. And then there are the kids who cough and wheeze all the time, and they need to be on nebulizers or inhalers throughout the year. None of these are necessarily kids with asthma. Asthma is a long-term diagnosis, but kids, especially the younger kids who need nebulizers, oftentimes grow out of it. So what are these nebulizers? One of the most common ones that you'll hear is called albuterol. Another version of it is the trade name Xopenex. And this is a bronchodilator, so it will open up the blocked air passages in your child's lungs between the windpipe and the lung itself and allow for more air to go through. It's pretty simple. It can be used acutely, so if your child is suddenly having breathing problems, coughing, wheezing, trouble breathing, and it can also be used as a maintenance medication. One of the major side effects just to know about is it has a little bit of a stimulant effect to it, so it may make your child feel a little bit jittery, may increase their heart rate, so if it's their first time using it, their doctor may want to monitor their symptoms more closely. Another very common nebulizer is budesonide or Pulmicort. And this is an inhaled corticosteroid, so it is a steroid, and there's always some concerns for that. It will reduce the swelling of the small airways on a long-term basis. So if your child is having an acute problem, Pulmicort or budesonide is not going to help. This is a maintenance medication, keeps the inflammation down, allows for their breathing to get better, but it doesn't work in a more acute emergency situation. So how do you do it? It's very easy. You get the prescription from your doctor. They say go buy the little nebulizer machine and go home and do this with your 18-month-old. Well, that's much easier said than done. So we really have to think about creative ways, and you know your child best, so what works best? Distraction, could be a TV, video, songs. They can play on their little computer if that helps. A comfortable, quiet setting. If they like their high chair, they can be in their high chair or your lap or a bouncy chair, depending on the age of your child. The first thing you want to do is let your child just get comfortable with the mask. It's a little scary at first, and some of these masks now have little animal faces on them, and they can hold it. They can feel the air and the steam. Don't worry about the first treatment. It's not really going to get in there. So just let them play with it. Let them have it in the vicinity. See that it's not going to hurt. It's not a shot. It doesn't really have any taste or smell. And then each time that you do it, they'll get more and more comfortable. But this isn't something you can go home and stick a mask on your child's face and expect them to get a great treatment. You have to give it a little bit of time. Most kids do get comfortable with it and they get used to it. They realize it doesn't hurt. They actually feel better after getting their treatments. But your doctor may say use this every 4 to 6 hours, and again, that's very easy to say, but the reality may not be so easy. So we've been talking about colds in kids. Now what about if it's a newborn? And all of what I've talked about really just goes out the window, because a fever, a low-grade fever, 100.4 or above in a newborn under age 6 weeks is a reason actually to go to the doctor. You're not going to take your 3-year-old to the doctor if they have a fever of 100. But if it's a newborn, you do want to have them seek medical attention. There are a lot of illnesses. Newborns are not quite protected from most anything, so a newborn with a fever really needs to be assessed. If it's a 3-month-old or under, 101 or above also warrants a trip to the doctor. Infants have very immature immune systems. They do have some immunity passed on by mom if the mom is breastfeeding or if the mom's received immunizations recently. They have a little extra immunity, but they're still quite fragile beings, so we need to treat them a little bit differently than we would treat our older babies or our kids. And what if they're not sick? Obviously we're talking about winter illnesses, but what about that child who just has a stuffy, runny nose and they're not sick? What do? Can you send them to school? Do you have to keep them home? Do you need a note from the doctor to say this is just a stuffy kid? It's certainly fine usually to send these kids to school, but you really want to know what it is. Most commonly allergies, and kids 4 and up can really be tested for allergies now. I'm talking about environmental allergies, not food allergies. Big adenoids. The adenoids are like a second set of tonsil tissue that sits behind the nose. And if your child has big adenoids, they may have a chronically stuffy nose. They may seem like they're always sick, but they're not. So these are kids that your pediatrician can assess and possibly send to a specialist. And then what's up there? If you have a child who's otherwise healthy and one side of their nose is stuffy or runny, there's something up there until proven otherwise. Kids like to put things up their noses, and they can sit there literally for months at a time. Tissues are the most common object that kids stick up their noses, but there has to be a good explanation for that, so those are the kids that need to be seen. Prevention. So what can we do to prevent all this illness? Obviously you can get immunized, but there are things that we need to do just on a regular basis. Hand washing with soap is best. It sounds very simple, but it actually does make a big difference. It makes a difference in the hospital when we take care of patients, and it makes a difference at home. Teach it early. As soon as your baby can stand with assistance, they should learn to wash their hands. You can make it into a song, and it should take as long as it takes to sing ABC or Twinkle Twinkle, which are actually the same song, or Happy Birthday. So they should be able to sort of associate hand washing with something fun, singing a song, playing a game. But it should be routine. It shouldn't be something that they just do when they're sick. Covering your cough, they want to cover their cough with the crook of their arm, not their hand, because then their hand becomes contaminated. And toddlers and kids like to touch everything, so you really want to teach them to cough into the crook of their arm. And then if you have an infant at home and a toddler in preschool or in daycare, have your toddler change their clothes, at least their shirt, when there's a newborn in the house. There's so much on their shirt when they come home that if you change it, it may make them a little less susceptible to spreading these illnesses to their babies at home. And then hand towels that you have in the house. If someone's sick, make sure you change them more often than you normally would. Don't share them if your child is sick. Something like pink eye is extremely contagious. It's usually viral, but if they're all wiping their hands and their eyes on the same towels, everybody in the house is going to get it. And then good old nasal hygiene. Obviously noses are not pockets, so make sure your children know not to store things in there. The most dangerous thing a child can put up their nose is a disc battery, these tiny little batteries that are supplying all of our technology. It can erode the nasal tissues within a matter of hours, so make sure your kids know not to stick things up their nose. Nasal saline is the one thing that you can stick up your child's nose safely. You can use it as a spray, as a drop, or an irrigation. And every family member during the winter season especially should have their own bottle of labeled saline, so you don't want to share these. And you want to irrigate the child's nose as often as they will tolerate. The younger you start your child doing this, the more likely they'll go for it when they're older and they can actually do it themselves. You want to minimize suctioning, especially in your infant. Usually go home from the hospital with one of those plastic suctions, but what that does more often is just causes some more swelling inside of the nose, doesn't really help with the secretions and the mucus. It just causes some more swelling. So irrigation with saline is actually better than a nasal suction. It's better if your baby is upright. Even in the infants, hold them upright. They don't like, they get sort of that drowning sensation if you're sticking saline in the back of their nose and they swallow it a little bit. So have it upright and just spray a couple squirts in each nostril. Most of it will drip out, and that's fine. It still acts as a great irrigation system. And so in general, you just want to protect yourselves around you. And again, I will just reiterate, you should all get immunized. Get your boosters. If you're not sure what boosters you need, you can check with your doctor. Make sure your kids are up to date with their immunizations. There is so much preventable illness out there. The flu is the big one we worry about in the wintertime, so you want to make sure that we keep everybody safe and healthy. And thank you. And we can take any questions and use the hashtag UCLAMDchat. Okay, so the first question is, what immunizations should parents and caregivers get in preparation for a new baby's arrival? That's a great question. I would say mom and dad and any caregivers should have the flu shot. They should have an updated pertussis or the Tdap vaccine. And depending on your age, there are other vaccines. If you're a little bit older, the pneumonia vaccine, the shingles vaccine, these are all very age and person specific. But I think the basics are really the flu shot, the pertussis shot, and that, because that's what your newborn is not protected about. Your newborn up until age 6 months, and if they're born anytime in this time of year, they can't get a flu shot. So they're not going to be protected from the flu, and they're not going to be protected from pertussis. So those are the two biggies I think that caregivers should get. And another question is, what body temperature warrants a doctor's visit if parents suspect an infection, whether it's bacterial or viral? So a lot of that depends on your child. If you have, again, an infant, a young infant under 3 months to 6 weeks to 3 months, that age range, with any fever, it always warrants at least a phone call. And if nothing else, your doctor will say, nothing to worry about, give them some acetaminophen or some ibuprofen, they're fine. High fevers, if there's another issue going on, that also may not necessarily warrant a call. It also depends on how your child feels. If your child has a high fever, say 102, you give them a fever reducer and they are running around the house after that, you don't necessarily need to bring them into the doctor. These are the kids where the fever stays high, you can't bring it down, they seem lethargic, they're just not themselves. And my just sort of general rule is that if you're worried, don't worry alone. There's something going on. You know your child best. So again, even if it's just a phone call for your doctor to say it's fine, there's something going around, there's always something going around, then it's fine to make a phone call. People always ask about febrile seizures. If their child has a really high fever, are they going to seize? And febrile seizures, which are terrifying, actually have to do with the rapidity of the temperature increasing. So it's not necessarily a high fever. So if your child goes from 98 to even just 100 or 101 quite quickly, that can trigger a febrile seizure. So the number is not as important as how your child looks. Okay, so how long should I keep my child out of school when they have one of these illnesses? Well, the rule that my mother always said is that 24 hours of no fever without any fever medicine. So that I will still go by, Mom. If your child is still coughing and has a wet cough and has a little bit of a fever, don't just give them some Tylenol and send them off to school. You know that's not the right thing. You know you would not want your child to be around a child who's sick. If your child is filled with tissues and has that runny nose all day, they should really stay home until they're feeling back to themselves. What are the pros and cons of getting flu shots for children? There aren't really any cons unless your child is under 6 months where they can't get a flu shot. It hurts. The flu shot hurts for a few days. There's no way around it. The flu mist doesn't hurt. I prefer the shot just personally. But I think the main con is that they're going to have a sore arm or a sore leg for a day or two. You can sugarcoat it as much as you want. Shots hurt. The illnesses are worse than the shots. The risks of the shot are extremely low. The risks of the flu are extremely high. So to me, it's pretty obvious that it's better to get the flu shot. What can parents give their children to deal with cold symptoms? So again, a lot of the over-the-counter medicines, you can read the labels and they all say that they're going to cure the child's cough or cure the child's cold. It's not going to make them better any faster, and it may not make their symptoms better either. So it's just the basic stuff: liquids, rest, humidification. You can try some honey, which is actually safe for a cough, and then it's just a matter of time. They're going to get over it. Clearing their nose out can actually prevent colds from progressing to a sinus infection or ear infection. So that's certainly one of the best treatments that you can do. Should parents buy brand name products or generic products to treat common winter illnesses? I don't think there's probably much of a difference. There are some medications, whether it's an antibiotic, a prescription medication, an over-the-counter medication, where the trade name is slightly better or stronger, or they claim it's slightly better or stronger than the generic. Although if you look at the ingredients and you read the labels, and the label looks like it's pretty much the same ingredient, it's going to work the same as the trade name. But again, a lot of these medications don't work anyway, so you just want to be careful on using too much. What should parents of teenagers do to keep their children healthy? That's a great question. Teenagers, there's only so much you can do. That's why we really have to start young. You can't teach your teenager to wash their hands. If they don't know how to wash their hands by the time they're 13, you and they are in a little bit of trouble. I think it's also just, basic common sense to go all along. It's not you can all of a sudden teach a teenager how to take care of themselves. Teenagers need a lot of sleep, and most teenagers are sleep deprived. So you need to encourage your teenager not to stay up late with one of these till midnight every night and expect to wake up at 6 in the morning all perky. Teenagers need a good 9 hours of sleep every night. And if you are sleep deprived, your immune system is a little bit weaker. So sleep is probably the best thing that you can give your teenager, if they'll let you. Can I still have the flu if I have had a flu shot? Yes, you can. The flu shot is not 100% effective. You will not get the flu from the flu shot, but it is not 100% effective. Very few vaccines are actually 100% effective, which is why the more people who get immunized, the less likely that these illnesses will pop up. But again, most vaccines are not 100% effective, including the flu shot. It's actually a pretty good efficacy to have it up to 60%. But yes, you can still get the flu, but it will not be from the shot itself. Again, if you do not get the flu shot, then you have 0% protection. If you get the flu shot, you have about 60% protection, which is pretty good. Is there a way to get over a cold faster? Colds usually just run their courses. And again, most of the medications, and especially antibiotics, will not make you get better faster. You may think you're getting better faster, but it usually lasts 2 or 3, 4 days, and that's pretty typical. Nasal saline is good to just clean things out. Sometimes the nasal decongestant may help you feel better and may allow for you to drain more quickly. Rest is obviously a good thing to do. You don't want to overdo it and push yourself when you have a cold, because in all likelihood, that cold will last even longer. Is there a trick to using a saline solution on a child? There are many tricks. And what I usually recommend, depending on the child's age, again, if it's a newborn, I recommend that you have them sitting on your lap facing out, and then to put the nozzle in first into their nose, and you want to sort of aim it back, not up. The nasal airway goes back. It doesn't go straight up. So you want to aim it a little bit back, and then just a couple little squirts. And again, just like the nebulizers, you're not going to get it on the first try. Most of it will drip out, which is fine, and use it just as an irrigation. So holding your child, the younger they are when you start, obviously the easier it will be. And for older kids, I usually recommend having them try it with you. So they can squirt the bottle, they can play with it, they can squirt it around the room, squirt it at you. You try it first with your own nasal saline so they can see that it doesn't hurt. And then have them do it with you, because they don't like having things done to them. It's very uncomfortable, but have them sort of squeeze the bottle with you, and they'll realize that it's not that uncomfortable. You can do just a very fine mist. So, those are some of the tricks. It does take a little bit of time. Some of the kids like to do it in the bath. That's another thing where you can make a mess with it. And it's sort of part of they're wet anyway, so they don't really mind getting their nose wet a little bit. Some babies, although not too many, would prefer it as a nose drop, turning the bottle upside down, and it'll be like a little dropper. That actually most of the kids find a little more uncomfortable than just the fine mist of the spray. What are the causes of the most common winter illnesses for children and adolescents? The most common cause would be the cold virus, and then some of the other viruses are less common. The flu is actually a very common cause of winter illnesses. Ear infections we see a little more in the winter months, usually because the kids already have colds, so they progress to ear infections. RSV, which is a pretty common virus, again that's a little later winter, so February, March into April and May that we see. What house conditions work best to keep children and adolescents' resistance to cold and flu strong? So depending on where you live, which part of the country you live in, you will probably have some sort of heat during the winter months, and most heat that we have is dry. So a dry environment is not necessarily so great for your resistance for colds. You need a little bit of humidification, so a humidifier, certainly if you have a young baby or an infant, a humidifier in your child's bedroom may help with minimizing their cold. Keeping your house clean, obviously, is a good thing. One of the number one indoor pollutants is tobacco smoke. So if anybody smokes in the house and your child is exposed to secondhand smoke, they are much higher likelihood for getting asthma down the line, bronchitis, pneumonia, colds, respiratory illnesses, and also those illnesses will last longer if they're exposed to secondhand smoke. So it's very basic, but there are millions of people who still smoke, so no smoking in the house. Even if you smoke outside of the house, your child has exposure to what's called third-hand smoke. So the smoke, all the toxins that are on your clothes that you hang up in your room or that you're wearing around your children are also exposed to smoke if you smoke out of the house. So it's better, but it's still not great. So stopping smoking is probably the best thing that you can do for your kids. And I think we have answered all of the questions. If there are any more, I'd be happy to answer them. You can hashtag UCLA MD chat. And the Twitter is at UCLA Health. And thank you again. I hope you enjoyed it. Stay healthy.